Categorize overuse injuries in 4 categories. Stage 1, we talk with athletes a lot about this, so they understand how to make these decisions, because stage 1 would be, they do their practice, they do their workout, everything's great, there's not a problem at all. They take their drive home, they get out of the car, and they notice their knee is sore. They feels like it's a little bit sore. And they don't even think about anything. It goes away and you don't even think about it. We call that stage 1. Level 2 would be they're warming up and they notice their knee is sore a little bit. Maybe it's a little bit of soreness, but it goes away after the warm up and they play, no problem. And then again, they take the ride home, they get out of the car, and it's a little bit sore again. So a little bit at the beginning, in the warm up, goes away totally, and a little bit later on after the activity's over.
I would assume that's very common, right?
Very common. Stage 2, very common, because stage 3 is just like stage 2, but it doesn't go away during the workout or during the activity. Like you kind of feel it throughout the activity. Here's the key. It's not interfering with the performance, right? So it's like you can do everything that you need to do. Nobody is gonna ask you, is something wrong? And you feel like, hey, I was able to get through my whole workout without a problem. I felt it a little bit, but it must be okay because it didn't interfere with my ability to do what I need to do. A lot of people live in, that's stage 3. Stage 4, just like stage 3, but the difference is the intensity. And really the criteria in stage 4 is that now your coach says, what's wrong? I could see you're holding up. You're not trusting this. It's clearly, now you're not lifting as much weight. You have to stop in the middle of your set of push-ups. It's like, it's hurting. That's stage 4. Okay. Stage 1 and stage 2, we could live there. Like you could live in stage 1 and stage 2.
I hate to say it, but it's almost part of trying to become better.
It is a little bit. It is. Like runners, for instance, right? Runners are always worried about overtraining. And I say to every runner I treat, you're overtraining anyway. Just accept it, because running high mileage is just, it's not really like a natural thing. I'm not saying it's wrong. It's not wrong.
It's very repetitive.
But if you have that, it's repetitive. It's just over and over again. And as the way a lot of sports are, dance, gymnastics, these kinds of things. And to a degree, a lot of so you're always you accept the fact that you're overtraining a little bit, because that mindset helps you then to make better decisions, so that then you can do your cross-training a little bit more, right? If you're in stage 1 and stage 2, and you understand all the stages, and you understand what your management strategy is, meaning like, okay, I got to do some correctives. Like we could talk about correctives too, right? But I've got a couple things. I went to the physical therapist, or I saw this online or whatever, and I'm going to do a couple of these things for my knee or for my ankle. I'm going to do a little ice massage at the end, or whatever it is. As long as you're doing that, then you can live in stage 1 and stage 2. If you're in stage 3, or certainly stage 4, then you must rest.